Hey everyone, this is Reggie from Restore Plus Physical Therapy. Have you had shoulder pains before? I know I've had some experience with that. Sometimes when I'm working on something either at home or even just playing with my son, sometimes I feel this pain on a lot of times on my dominant hand, on my right shoulder. That can be the most common causes of the shoulder pain are, one is you have repeated prolonged activity. It can be something that seems light, that seems benign to us, right? And we don't really pay attention. But if you do it for a prolonged period of time, it actually irritates your shoulder, it irritates the tendons and the structures in the shoulder, and then it's going to cause pain. The other most common cause of the shoulder pain is if you do some heavy lifting. If you lifted something heavy, you strain your shoulder or it strain the tendons in there. So you will have some inflammation and you're going to have pain also. So those are the two most common causes. And for me, I'm guilty of doing both of them. So I've had some shoulder pains before. If you've had some pains in your shoulder before, I think you can relate. It can be pretty annoying, especially if it happens on your dominant hand. And also severe enough, if the pain is severe enough, it can be actually pretty debilitating. Like for example, if it happens, let's say you're right-handed, it happens on your right hand, you're gonna have a lot of difficulty, you're gonna have a hard time reaching up, lifting, doing your daily activities. A lot of my patients, they even complain of having difficulty, even just simple as dressing or cleaning themselves, right? So those activities can be quite difficult. So I'm gonna share with you three things. What are the main things that you should avoid when you're having shoulder pains? So number one is I want you to avoid repeated activities, prolonged repeated activities, especially if it's overhead. Because prolonged repeated activities, what's going to happen is as you keep doing it, it's going to irritate most of the time the tendon there, rotator cuff tendon. You usually hear that from people. They have rotator cuff tendinitis, or some people call it the rotary cuff, right? You hear that a lot from people. So they're talking about the rotator cuff tendon, which is very common, is the reason why we're having some shoulder pains. That's the one that gets injured. So if you do prolonged repeated activities, especially overhead, it's going to irritate that or the bursa in your shoulder, and it's going to cause inflammation and it's going to cause pain. So avoid that. Second is, avoid heavy lifting. So basically the two most common causes of the shoulder pain, you want to avoid those. Especially when you have inflammation already, you want to avoid heavy lifting, especially again if it's overhead. Why? Because it will strain the tendons, it will irritate the bursa in the area, the structures there, and then it's going to cause inflammation, more inflammation, and it's going to cause pain. So I want you to avoid heavy lifting also. Now, the third one is I want you to avoid sleeping on that side. Okay, this is a very common complaint I hear from my patients, that they wake up in the morning, that shoulder is actually more painful. Why? It's because in my experience, a lot of people are side sleepers. I myself, I like to sleep on my side. Now, some people prefer to sleep only on one side. If that happens to be the shoulder that's painful, then that's going to be a problem, because they're going to keep sleeping on that side. And when you sleep, let's say right shoulder, and I sleep on my right side, you're going to have weight on that shoulder for a long period of time, all right? So it can be if you're sleeping 5 hours, 6 hours, 7 hours, you're going to be putting weight on that shoulder for majority of the time, and you're not moving. So you're not relieving the pressure there because you're not conscious. You don't know that you have to move. You have to rotate or turn to the other side. So if you put the weight there, even if it's not a lot, if you put the weight there for a long period of time, that's going to irritate those structures. That's going to cause more inflammation again, and that's going to cause more pain again. Okay? So I want you to avoid those three things if you have shoulder pains. It doesn't matter what's the cause of your shoulder pain. It doesn't matter if it's a rotator cuff problem. It doesn't matter if it's a bursitis. I want you to avoid those three things. They are applicable in almost all the problems that you have on your shoulder. Okay, so number one, avoid prolonged repeated activities, especially if it's overhead. Number two, avoid lifting or heavy lifting, especially if it's overhead again. And number three, I want you to avoid sleeping on that side, sleep on your back or on the other side. Okay, so those are the three things I want you to avoid when you're having shoulder pains. What do you think? I would love to know, what you think about this. I would love to hear your thoughts. And if you are having shoulder pain, I want you to try this and then see how it feels. If you know somebody who has shoulder pains, definitely share this with them. It's going to be helpful for them. Thank you very much for your time, for watching this video. Remember, I need you to comment, like, subscribe, and share this video so it can help transform other people's lives. And let me know what you want me to discuss or talk about in the next video, so that way I can help you stay pain-free and stay healthy. I'll see you in the next video.